Kampala's main stadium, now a temporary hospital for COVID patients. The Ugandan government says this makeshift treatment center is only for mild to moderate cases. But CNN witnessed a body being carted away. Last week, the World Health Organization says cases here were up 137%, the second straight week of triple-digit spike in infections. Across town, 40-year-old Stephen Tambi was finally well enough to be taken off a ventilator just hours before we arrived.
Now that I have a second chance, people shouldn't play with their lives recklessly when it comes to COVID. The way I feel now, I feel like God has given me 1,000 more years.
It's all hands on deck at this hospital. The ICU has been over capacity for the last 2 weeks, even after adding 50% more beds. They keep turning away new patients who need critical care.
I believe we had a bed, but then we got emergencies and we may have used up the bed.
But the calls keep coming. How many similar calls have you had today?
I don't know. I could say over 15 calls just since morning.
Every patient in this wing of this small private hospital is on life support. It's also taking a strain on the staff, some of whom have had to do 24-hour shifts because the need is far greater than the medical professionals available. The average age of the patients is 40, doctors tell us. The youngest was only 18.
Why exactly are we seeing young people? One is that for sure it's a more aggressive strain. But the other thing also could be that, you know, after the first wave, we might have gotten quite excited enough to slacken on, on our preventive measures.
It's a crisis that could have been avoided, says Uganda's top health official.
If we got this vaccine at the end of last wave, our community would be much better than what we are experiencing now.
Considering you have only vaccinated 2% of the Ugandan population, when will you have enough people vaccinated that life can return to normal here?
I cannot answer that because I'm not in charge of, I cannot access the vaccines. If I could access the vaccines, even tomorrow would conduct a nationwide campaign and vaccinate.
With almost all Ugandans unvaccinated, the government warns that each positive person could infect between 80 to 100 people. Uganda has strict social distancing guidelines, but it's business as usual here in downtown Kampala. People have to be here to make a living. It's impossible to work from home. But they may have little choice for the next 6 weeks, as Uganda is now in partial lockdown again. Larry Madowo, CNN, Kampala.